Well, June is Men's Health Month, so tonight we're talking about how to help get the men in your life to the doctor. Joining us today to discuss is Dr. David Rzeszutko from Priority Health. Thanks for being here today.
My pleasure. Thanks for having me.
Of course. So we don't want to generalize, of course. I'm sure there are many men who are on top of this and don't need to be told. But there is
Yes.
some concerning research out there. Something like 30% of men, 33 actually, are less likely to visit the doctor's office than women are. So, doctor, why do you think that
Yes.
is from what you've seen?
Yeah, so Shane, it's really good to call out that, these recommendations should be applicable to a larger audience as well. But there is definite disparity. So men in between ages 30 and 60 years old are significantly less likely than women to seek preventative services. They're more likely to report not having a primary care provider. And so men are great minimizers of their health conditions and be avoidant or frankly neglectful of their health care. And really the problem with that is we lose the window to be proactive with our health, right? So earlier diagnosis means impacting conditions when they're most treatable. And many diseases that disproportionately affect men, like heart disease and cancer, et cetera, are really preventable through regular doctor visits and healthy lifestyle choices.
Yeah. Do you think it's kind of that mindset of if it ain't broke, don't fix it? If they're waiting for something to be significantly wrong, what do you say to the men in your life, your male patients, to try to convince them to not only go when something's very wrong, but to have that maintenance, those preventative appointments as well?
Yeah, so, physician avoidance can be from a number of different things. Maybe it's fear or anxiety. And actually, there's a clinical term for this. It's called iatrophobia, or fear of doctors, right? Which is a true clinical term. It's maybe more related to white coat syndrome. And the discussion with someone is really what's the origin or what's the reason that folks don't want to go to a doctor, right? I oftentimes hear patients say that it's wasted time going into waiting rooms, or I don't want to get any lab draws or pain associated with that. And sometimes it comes from a fear of just not knowing or maybe lack of control, right? And so we really seek to demystify the practice of medicine. Your physician is a person too, right? They're a father, a brother, a husband, et cetera, with probably the same fears and worries that you have. And so educating folks and some general recommendations that we can give you would be prepare in advance, right? Maybe make a list of written concerns and bring that with you to your physician. So that way you can kind of talk through it point by point and you won't miss anything. You may also want to bring someone with you. So have kind of your proverbial wingman to help you through the office visit and make sure that what you're hearing is truly what's being said. And then probably the biggest recommendation is just be honest up front. What do you want to get out of your healthcare experience, and be early and proactive in the healthcare that you're seeking. So that honesty up front will pay dividends in the long run to establish just a good preventative healthy relationship.
Sure.
So that way when you are ill, right, and when you do have a problem, you don't have to worry about establishing those bonds.
All right, great tips. I love bring a wingman if you need him. Hopefully this will help convince a few of our men out there to head into that office sooner than later. Dr. David Rzeszutko, thank you so much for your time today.
My pleasure. Have a great day.